obstetrician and gynecologist at the Savannah Hospital, Upper Hill, Mara Road. I'm introducing Esther Wanjiro. Esther Wanjiro, we have walked a journey with her right from when she came over with the diagnosis of endometriosis, and we have taken her through in terms of the counseling, the discussion, the education, the medical, the hormonal, and finally the surgical intervention. Endometriosis is our topic for today, and we want to learn more about endometriosis and even more to be able to understand how to cope with endometriosis. Remember, endometriosis is a chronic disorder, but it is doable. One is able to live a normal life, to undergo their duties, and even to be a family person, even when living with endometriosis. Then we have the pleasure of inviting Esther. Esther, kindly introduce yourself, and then you tell us more about your journey with endometriosis.
Good morning. My name is Esther Wanjiro. I am an endometriosis warrior. I am married to one Mwangi Gidhae, and I am a mother of three, that is Andy, Alma, and Adwell, and I work for Laikipia University. I am so excited to be here at Savannah Hospital to discuss about my journey with endometriosis. So my journey precisely started when I was in Form 4. Then this time of the month, during the menses, I used to have so much pains. And that is when my sister realized that this was not a normal pain. And so she requested my mom that we would seek further medical consultation. So that is the time we started the journey. I remember we came for consultations in Nairobi. We visited several hospitals. We consulted with several doctors. And the first step was to do ultrasounds. And then that is when it was realized that I had adenomyosis. And then some scans would also show the endometriosis. So the treatment began. I was put on hormonal therapy for several years. This has been a journey of 18 years up to now, and it has been quite a challenge. Yes.
Thank you, Esther. Viewers, as you can see, it's a chronic problem. It's a problem that can start very well early in life, and it takes a long time. For Esther, yours has been 18 years.
Yes, 18 years.
And you have mentioned something about adenomyosis, which I want to just clarify to the viewers that endometriosis is a condition where those cells from the endometrium go to other areas, and they cause a lot of pain. Adeno is when those cells are within. In fact, this diagram here that we can use shows adenomyosis. Adenomyosis is exactly this one. The cells from the endometrium stack themselves into the wall of the uterus. Endometriosis is when they go away. You can see now, like, we have some dark spots, near the ovaries, and there are some, on the other ovary, there are some on the outside the uterus, and then they can go to other areas, even to the chest, some even go to the brain, and they can actually behave like cancer. So you can see, viewers, like Esther, they did ultrasounds, and the pain has been there. Did they give you something like antibiotics in the initial years?
Yes, they did. They did give me some antibiotics and basically painkillers because the pain was intense.
Yes.
Yes.
Yes. So what I'm trying to say is that sometimes we do confuse adenomyosis with pelvic inflammatory disease. And there are so many people out there being treated for chronic inflammatory disease, and yet they have endometriosis. How was the pain for endometriosis in relation to periods? Was it coming before periods or during periods, or how was it?
So basically the pain was prior, before the periods, and during, and even after. Yes, and so, very intense.
Very intense.
Yes,
very,
yes.
very severe pain. So, so as you can see, the pain for endometriosis, just for Esther, you start before the periods. Why? It's because those cells of endometriosis are in other areas. So whatever is happening in the periods inside the uterus also happens in these other areas where the endometriosis cells are. And since those other areas are exposed, so you find that they start causing pain, some bit of bleeding, because the blood is an irritant. It's sort of like a chemical contains molecule. That's why you are getting a lot of pain. And it started around when you informed
Four. Yes.
Yeah, it's been a long journey. So when the diagnosis was made and it was decided is endometriosis, so how then was it managed?
Now, that was in 2013 after I got my firstborn. Viewers, I live in Nyahururu, so I was under one of the guy in Nyahururu. Yes, and he's the one who made a referral to Dr. Murage. So basically, he told me that he is a guy in a fine, but my case would be important if it was handled by a specialist in endometriosis and fertility. So that's when he referred me to Dr. Murage. So since 2013, it's been a journey with Dr. I remember the first consultation that we made with Dr. Washira Murage. He insisted that we needed to do an MRI. So at that point, that's when the endometriosis was really discovered around my pelvis.
Yes, because MRI normally gives more details. So you find that when you do an MRI, you're able even to stage, because endometriosis has some stages. It's mild, you can have stage 1, 2, 3, 4, depending on the extent. It's just near the uterus, in the what we call the tubes and the ovaries, is stage 1. If it has touched the intestines, it's stage 2. It has gone beyond, beyond beyond very far from the pelvic cavity. Then you have stage 3, and stage 4. It goes to other areas. US was about stage 2, around stage 2 initially, because remember there were deposits around the pelvis, and I remember you had a swelling around that next area, the area next to the ovary. So how did you feel as you grew, older from Form 4 going forward? Now you have endometriosis. How was that journey before you came to us? What challenges were you going through apart from the pain? Were there any challenges that you also going through? Maybe you were a student, are you missing school? How was your academic progress? Did you have your dreams? And then after during college, were you able to perform, or was it really a torture?
So, Dr. I think what I can say is the journey has been really tough. Now, that time I was in Form 4, and here comes a situation, and you've been diagnosed with a condition. Now, being the young girl I was, I didn't understand what endometriosis was. So I was a bit anxious. I really wanted to know what it entails. Didn't have the information. So it was really tough. I remember I used to miss classes during my periods. And then that was it. During my college days, life was also very hard. Endometriosis is a condition that would even affect your social life. You realize that most of the times when you're in pain, you don't interact so much with others. So you don't attend classes, you have very few friends. It really affects your quality of life, because you realize that other than pain, there are other symptoms like fatigue. At times you're depressed because you don't even know what the future holds. And then from the information that you get, even out there in the social media, you hear of endometriosis can possibly cause infertility. So you don't really know if you'll be able to bear children. So you're anxious, you're depressed, your quality of life really changes. So there has been challenges. So post-college, then I joined work. So that was another really challenging environment. because you're maturer. So you meet new people, you're in a working environment, you're expected to deliver, but unfortunately, you cannot be at work 30 days in a month. There are days that you can't perform. So you get leave days, you get offs. And if you in an environment where you have really those strict bosses, then it becomes difficult because it would mean that you're forced to work even when you're in pain. So your social life changes, really your quality of life. So at workplace, you cannot perform. You cannot really perform to your maximum. Yes. And then after that, you get into family life. That becomes another major challenge. So God helps you, you get a partner. But because of these incidences of pain, painful periods, at times the periods are excessive, and then now you're in a family, you're expected to be a wife. There are these challenges. Someone is expecting you to be normal, to be able to perform your womanly duties, but you cannot. So it causes a bit of tension even in the house. At times you have disagreements. So it has really been a challenge, and it can be challenging, and especially Daktari, if you don't have a support system or people around you that are not giving you support, then it becomes harder. But if you have people who are supporting you, you have people who are understanding that this is it, this is what she's going through, so they take you as you are. So if that does not happen, then the situation becomes harder.
Thank you. Yeah. So we can see that endometriosis is a complex issue.
Yes.
In as much as we just say cells that have moved out of the uterus to other areas, these are complex issues. And cut across both, your social life, your working life, and your family life. And therefore, we see very clearly from your story, and thank you so much, that's why you are a warrior, you're a warrior, because you have won the battle of endometriosis. Because it started when you are young, you've gone through secondary school, then you went to college, you're working, and you're still working. You're married, and you have told us that you have 3 children, and you have a husband, and you've been married for how long now?
13 years.
13 years with endometriosis. So endometriosis, yes, for viewers, just understand is a condition, that you can stay with, but you can still continue doing your work. And at this juncture, what we want to, request the government and the employers is to remember the ladies with endometriosis. We can actually appreciate the issues that are going through. The pain is so much. You cannot attend to work. The support system maybe in some people with endometriosis may not be as good as you had. Yes, so there will be quarrels. So psychologically you are affected. So by the time you are going to work, even the output is reduced. So we ask the employer, the government to have policies in place. When someone is through diagnosed with endometriosis, for them to be able to be given some kind of special treatment and to be empathy, because endometriosis can be debilitating. Endometriosis can affect even our output. In our workplace. So how are you pregnant? Do you have any issues? How would you comment when you got pregnant, when you had endometriosis? And the viewers now can see one can have a family with endometriosis. How are you pregnant? Do you have any specific challenges? Or is it that when you got pregnant, the endometriosis kind of stopped?
Yeah, Dr. I would say that initially it was a challenge to conceive. In fact, I remember you putting me on fertility drugs, so at least to try and boost a bit. But eventually I conceived. And when I conceived, the symptoms are a bit slow, yes. So, but I realized with the childbearing age, I think the endometriosis symptoms were increasing. Yes.
Yes, that's actually what happens during pregnancy, the endometriosis. So, kind of and after you deliver, most of the endometriosis will come back to the body. All this is because of the hormone changes. Exactly that's what happened. apart from the painkillers, then you had some hormonal treatment. Did you have some surgery in the prostate?
Yes, apart from the hormonal therapy, I've been through two laparoscopic surgeries, yes, with Dr. Washira, and they have really been helpful. Yes, because it's after, it's after the laparoscopic surgery that I was able to conceive a second time and a third time.
Right.
Yes.
So viewers, as you can see, endometriosis, in as much as it causes pain, is also recognized because of infertility. Because it can cause adhesions and therefore to blockage. Number two, it also affects ovulation. Right? Ovulation doesn't happen as supposed to. So that causes that. And then of course remember, psychologically one is disturbed, so even conception, ovulation, because of the stress hormones does not affect. So endometriosis is a recognized cause of endometriosis. So you notice from Esther's story, which she has given us very well, is that there was some bit of painkillers, for pain control. Then it advanced from painkillers now to the hormonal therapy. And then it came to a point where you now needed laparoscopy. So it is not always the time that you need, all the time that you need surgery. In surgery, laparoscopy is needed when you have like swelling, because endometriosis can cause things called endometrioma, some swelling. Endometriosis can affect the intestine, because we talked of one method of classifying endometriosis. You can also have another one that says superficial, moderate, and deep infiltrating. Endometriosis can, and you're likely to have that. There are people who undergo surgery just to remove a portion of the or a portion of the bladder, because that endometriosis has infiltrated those organs so much until a portion has to be cut. So surgery, normally say surgery is confined. You really have to think twice before you go to surgery. So this is infiltrating operation, when it has caused blockage, when it has infiltrated the bladder, then you can do the operation and do that. Some people may need removal of the ovary. Some people may need removal of the uterus, especially if they are done with their childbearing, the endometriosis is so much. We know a situation, or we are aware of a situation whereby when you move the uterus, is good, and dramatic improvement in the symptomatology of endometriosis. If you look at that journey that Esther has gone through, is that the treatment is multidisciplinary. This is not just one. There are situations where one would need a urologist, especially if it has infiltrated the bladder. One would probably need a general surgeon to do that operating the intestine, because it has infiltrated the intestine. There are other times you may need other people. I don't know whether you had a psychologist on board, maybe when you went back to your room, or some bit of physiotherapy. I don't know whether you had those two modalities of treatment, counseling, and maybe a physical therapist to show you some exercises. I don't know whether you had that in your room.
Not really. What I had was some counseling.
Some counseling.
Yes.
And you can see, if you look at Esther, she's strong and vibrant, quite beautiful. So it means that she must have gone all those processes. Counseling is so key. And counseling, what is it for? To help you cope, to help you rehabilitate, so that you know that even if you have endometriosis, you're still a woman that can go on with their life. They can be protected. They can fend for their families, just like they're doing. And you should not continue. Endometriosis is not cancer. Endometriosis will not do really adverse effects on your body. So you had counseling. So another mode, which is now an emerging treatment for endometriosis, is what we call physical therapy. We now know that you can use, because what endometriosis does, especially the pelvic endometriosis, it causes inflammation of the endometrium, and the ligaments become very, very tight and spastic. When they are that tense and spastic, what happens is that they become so tense and help you alleviate the pain, because the commonest problem with endometriosis in the world is the pain around the skin.
There is hope, and especially with early treatment and the correct treatment, and following what the doctors are telling you, having a support system, then life is normal. Life is normal, and you get to appreciate, you get to accept. And endometriosis is not a death sentence. No, 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 no. You can still be productive, you can still live a quality life, and with God on the throne, and with such people who are knowledgeable like Dr. Wachira, then life can be normal.
So in case you think you have pelvic pain, it just comes around, serious pain. Do get early treatment, early consultation with a gynecologist, and then once the diagnosis is made, get the proper treatment, and you have seen the treatment is not for you. There are many things that you're told, there are many doctors involved, from the gynecologist, maybe a surgeon, psychologist, a physical therapist. We will take you through, and you live a normal life. Thank you so much, and keep healthy, keep lookout for endometriosis, and let's treat the ones with endometriosis with a lot of empathy. Let's show them the right direct, the correct